Hi, everybody. This is Lee, and I'm talking about a report, how American healthcare kills people. And Ryan Cooper is the author, and he tells of certain stories, such as one about Matthew Stewart, who required emergency surgery for hepatitis-induced liver damage, but did not have the money to pay the out-of-pocket expenses. Only about $10,000 of his $74,000 bill was covered by his gold plan insurance policy. Because of out of network rules, even in emergencies, and then his insurance provider decided to quit the insurance exchange. And so he was left without a liver specialist. And then he couldn't obtain Medicaid because his state of Texas refused the option to carry Medicaid. And so his only alternative remained to declare bankruptcy and then leave the state to a state that would cover him. But that would be delayed by a lengthy legal process that he was not physically and mentally prepared to endure. And so the hospital still kept sending him bills. And so that's just one example. There are many examples, but there is evidence of the financial collapse of a great majority of Americans. And a lot of it has been exacerbated by the fact that those who have medical issues that need to be addressed are seeing that a lot of their money is being taken by mandate and then handed over to the insurance companies. Or if they're willing to make a deal and attempt to pay the premiums, and then try to meet the deductibles and the co-pays and then the cost of prescription drugs, they're barely able to sustain themselves in order to do that. That's the transfer of wealth that we've seen, mostly by the healthcare system, but then by other means as well. And so there have been and there's a much published study that documents early deaths of white Americans with less than a college degree, and that they are suffering what is called deaths of despair, death by drugs, alcohol, suicide, largely driven by a deterioration in economic well-being. So drugs, alcohol, suicide, mental health programs have been cut, and then the prison system has been expanded. And so this is the quality of life that we're seeing. And there are people who are taking anti-anxiety drugs, and they can't afford those, and so they turn to street drugs, and then they get addicted, and then they can't afford those. And, there's always a search for somehow to make the pain go away. I'm going to leave a link to this really disturbing article in the description, also the report, and people can see why healthcare is such a stressful issue and how it has harmed so many of us. That Medicare for all is one solution. The fact that prescription drugs can be negotiated, that there's regulation and oversight, and a prevention of profiteering on the pain and suffering and then death of U.S. citizens. Good luck.